to answer some questions about the different programs that are going on in the Houston area. So let's go ahead and get started. I'd like to invite Reggie Young to come up and speak about the BUILD project with the Houston Food Bank.
Well, definitely I would like to thank you guys for inviting me to speak today. I'm very excited about speaking with you all today because at the Houston Food Bank, as you may know, we are all in disaster mode. And so to be able to speak about something that's not disaster related is actually refreshing because I haven't been able to do so in a long time now. So of course what I'm going to be talking to you today about is the food prescription program, which is one of the newest initiatives that we have taken a part in, along with some of our partners from the Harris County BUILD Partnership. And so the first thing I would like to do is kind of give you guys an overview of what the Harris County BUILD Partnership is itself, and then kind of dive into the different program components of the food prescription program, as well specifically things as far as what the food prescription program is, how we're implementing it at the clinics that we're working with, as well as what we are looking to achieve from it, but also what are some of the results that we're currently getting from the food prescription program right now. All right, so to back up a little bit, about 2 years ago, we received a call from Harris County Public Health. And they basically explained to us that there was a new grant opportunity, a national grant opportunity that was coming around called the Build Health Challenge. And so the reason they reached out to us was because I run a department called Food for Change. And the reason that we have a department called Food for Change at Houston Food Bank is that we're looking at ways in which to leverage the monetary and nutritious value of our food resources to support individuals that are participating in either health programming or educational training programs to see if we can utilize and leverage the value of those food resources to support them as they complete those programs. And so we thought that this was going to be a really good fit for us as a partner, along with Harris County Public Health, as well as MD Anderson Cancer Center, because of the goals of the Build Health Challenge. And so if you are familiar with public health at all or community-based organizations, you will know that we love our acronyms, and BUILD is actually an acronym itself. The acronym BUILD stands for Bold, Upstream, Integrated, Local, and Data-Driven. And so the requirements for this particular grant was that it would be all of these things. So the Build Out Challenge itself was essentially saying that we wanted community organizations to partner with a healthcare partner as well as a public health partner and really address a local issue and utilize an integrated approach to address the upstream causes of a particular health issue that is prevalent within that community. And so we thought that we could present something that would really work well within that setting and something that was valuable for the Build Health Challenge itself. And so the way that we one of the challenges that we saw, for one thing, was that there were about 400 community organizations around the country that were actually applying for this particular grant. And so we definitely wanted to be able to distinguish ourselves. There was only going to be given out 18 grants from all of these different partners and all these different collaboratives. 11 of those would be for just planning grants, and 7 of those would be for actual implementation of the programs. And so being from Texas, we knew we had to go big. And so we decided to try to be one of those organizations that received an actual implementation grant. And spoiler alert, obviously we were one of the 7 that were actually selected for that purpose. And we were the only one in Texas selected for that purpose as well. So one of the cool things that I always like to point out about the Build Health Challenge itself was that also the funders of that initiative were also being bold in the way that they work with one another. So essentially this grant itself was a collaborative initiative between several funders that were also wanting to figure out ways that they could work together to really address local issues that were prevalent in specific communities. Interesting. I didn't create the presentation, so that was new to me. So what we ended up doing was targeting one of the communities that was really a target for each of the partners that were involved, and that community was North Pasadena. Like I said before, that one of the requirements of this program was that it had to be really data-driven. We had a lot of data in North Pasadena really telling us that this was a community that we wanted to be very supportive of in our efforts. So early on, we selected North Pasadena, particularly 3 zip codes in North Pasadena that we really wanted to work in. And so the challenges in North Pasadena are plenty. North Pasadena is actually the historic downtown of Pasadena. And Pasadena, if you don't know, is the second largest city in Harris County itself. A lot of the development went to southern Pasadena, and so there's a lot of efforts that were really being bypassed in North Pasadena, and so there's challenges in the ability for people to access really large wages from the work that they were acquiring. There was a big prevalence of diet-related illnesses, particularly childhood obesity as well as diabetes. And there was a low availability of places where people could access fresh fruits and vegetables and other healthy foods on a regular basis. And so we really wanted to make sure that through our partnership that we were able to address a lot of those issues by really addressing the conditions that lead to food insecurity in North Pasadena. The way that we wanted to do that was through increasing access to a lot of different food resources within the community. So 2 years ago when we started, there was just not a lot of fresh fruits and vegetables or access to a lot of fresh places. And so right now, due to the work that we've done in North Pasadena, there's almost 20 different locations, new locations, for people to access a lot of fresh fruits and vegetables as well as other healthy food options. And so this is a map of a lot of the different initiatives that we're doing in North Pasadena right now. As you can tell, the different initiatives are very diverse, and so we've worked with a lot of different partners to really coordinate this effort in North Pasadena. 6 of our programs are healthy corner stores, and so essentially these are corner stores located in North Pasadena that we actually work with in order to increase the number of healthy options in those locations, as well as provide a lot of information to nudge clients that go into those stores to be able to know and understand what items they can receive and have better access to those items. We also added 6 what we call food prescription and food scholarship sites, and I'll talk about that a little bit more. 3 Healthy Dining Matters locations, and if you're not familiar with the Healthy Dining Matters program, that is where we work with a restaurant to change a portion of their menu to provide more healthy options for patrons. We also added 3 school-based food co-ops through the Brighter Bites program. And so this is a program where the organization Brighter Bites goes into a school and provides 30 pounds of fresh fruits and vegetables over the course of 8 weeks in the fall and the spring at those schools, and really provide a lot of nutrition education around that produce so that parents as well as the kids really understand what they're receiving, know how to prepare those items, and really trying to change eating behaviors with those food items. And we also added what we call a food pharmacy. And so essentially a food pharmacy is a pantry within Pasadena that we converted to basically having more healthy options to be able to fill the food prescriptions from the food prescription programs at. And the other component of it is we also received funding to basically build the first urban farm in North Pasadena, which we call Clara Farms. And so this is actually still in production, but essentially what this is going to be is a vertical farm as well as a training center for people to learn how to grow produce in North Pasadena. So as you can tell, we had a lot of different people involved with this particular program. Houston Food Bank, along with Harris County Public Health, MD Anderson Cancer Center, UT School of Public Health, as well as the city of Pasadena, basically led a backbone committee for this large-scale partnership. We were also held accountable by what we call our group of community trustees. And so these are individuals that work and live in Pasadena, and they were basically kind of our board. And they were always informed on things that we were doing, provided feedback on things that we were doing, so that we were held accountable for the initiatives that we were creating or expanding in North Pasadena. Along with that, we had a three-pronged approach to our goal of addressing the conditions that cause food insecurity in North Pasadena. One of those was what we called our production team. And so the production team ties directly into the urban farm that we're creating in North Pasadena. So for people to be able to grow produce as well as to be able to learn how to continue to do that for sustainable purposes in their community going forward. The second component of that was that we definitely wanted to have more distribution locations in the community for people to access healthy food options. And so that's where Barter Bites lands, as well as the Healthy Dining Initiative and the Healthy Corner Store Initiative. Now, the third component is the component that I was primarily responsible for, and that is the consumption team. And so on the consumption team was really be able to identify ways in which we could have more fresh fruits and vegetables for people to access that are free at this moment to really address food insecurity at the moment. And so that's where the food scholarship program as well as the food prescription program kind of led. Now, the interesting thing about the food prescription program itself was that it was the only program when we started this initiative through the Harris County Bill Partnership that was not already a program. So all the other programs that were tied to this initiative had either done this work in another community or were going to be expanding their current work in North Pasadena through this grant. And so the food prescription program was something that we all came together and for the first year really did a lot of planning on developing what that would actually look like for our clinical partners in North Pasadena or serving North Pasadena patients. And so it was really something that we built from the ground up and something that we really leaned on other partners nationally to really get a good understanding of what this could actually be and how could we make it and really design it to be very effective for the residents in North Pasadena. And so, of course, we had to work in conjunction with the clinical partners within those communities, and we worked with 4 clinical partners there, 3 of which were tied to the Memorial Hermann system. We work with 2 school-based clinics, the Wade Clinic as well as the Cruz Clinic. We work with 1 bariatric clinic located at Memorial Hermann Southeast, and we work with Pasadena Health Center, which is the only federally qualified health center in Pasadena itself. And so, as you can tell, we had a lot of work that we had to do in order to implement what became the food prescription program. But the first thing that we had to do was really understand the way that the workflows of these different clinics actually work. And so we set up several meetings with these partners to really come up with a way for them to, 1, screen for food insecurity at those different clinics, to identify people not only that were food insecure, but also in our target zip codes that would be eligible for the food prescription program. Second thing was, how do we work within your flow to make sure that they are then informed specifically about the different components of the program itself and understand specifically how they can actually redeem the food prescription in order to receive the food items. And then 3, how are we going to track their progress from the clinic all the way to the pantry side? And so with each of our partners, we created these process maps that really identified exactly what that would look like at that clinic, who would be responsible for their work on their clinical site, as well as what were the sticking points in which we had to provide specific information for the patients to be informed so that they know exactly what to do when they receive a food prescription. And so, as you can see, the eligibility criteria was very simple. It was really, do you live in that community, and are you screened positive for food insecurity? So, a big role that MD Anderson Cancer Center played in this process was actually working on developing the program itself with the clinical partners, but then also with the evaluation in conjunction with UT School of Public Health. So at each of the clinics, they work with them on creating the screener itself so that when a patient comes in, they can be able to identify whether or not they will participate in the program. They create a participation form, which I'll show you just in a second, that basically explained the program itself and gave the client an opportunity to sign up for the program if they wanted to. And then they also established process evaluations that would be implemented at the pantry, so where at the 3rd, 6th, 9th, and 12th redemption of the food prescription program, individuals would basically take a survey to learn more about their experience participating in the program so that we could evaluate whether or not it was having effectiveness for them. So this is the program screener itself. And so we use the 2-item screen at each of these clinics to identify whether or not an individual was food insecure. If a person was identified as food insecure, but they did not live in those zip codes, we provided them a resource handout as well as connected them to the closest pantry so that they could meet their emergency needs at that moment. And I have a short amount of time, so I have to speed through this. This is the participation form, which explains exactly all the details of the program itself. A person that reads this form will identify that one, it gives them the address to the food pharmacy, which is located at Pasadena Community Ministries, and they can go to that pantry up to 12 times over the course of 6 months to get up to about 30 pounds of fresh fruits and vegetables each time, so that they can help them to meet their food security needs. They also have the hours of the pantry itself and contact information so they can contact the pantry if need be. This is actually the prescription that they receive. It has a participant ID for the pantry to know that they are the person that they say they are. One of the things that we also added to this form is that we had substitute shoppers. So in case an individual could not make it at a specific time, they can have someone come on their behalf, just showing this and having their name on it, and we can see if we can identify them and so forth. And so on the back of that form, we also had a way of tracking their redemptions to know if they were on their 6th redemption, their 12th redemption, or whatever, so that we could be able to give them the survey if they were on that 3rd, 6th, 9th, or 12th redemption. These are the food items that they would receive through the program. We basically had a 2+2+2 system. They could receive 2 fruits, 2 vegetables, and 2 other healthy food items at their pantry. We try to keep it very simple for them. The pantry was also very generous, and they would give them a lot more than that at times, which was not always a benefit to the evaluation, but a lot of the clients did enjoy that. And so some of the preliminary results that we received was that 71% of the clinics were able to give out the number of allocated prescription cards that they had. Of that 71% of people, 67% of people actually redeemed those cards. And by April, we did about 63,000 pounds. We've done a lot more than that up until now. And the program will actually, the first part of the pilot will actually end at the end of this month. So some of the things that we learned from the evaluation itself was, one, that there was a significant drop-off in the number of people that participated from the 1st redemption to the 12th redemption. So there were a lot of people that were not completing all 12 of the redemptions. And so there's a lot of work that we need to do in order to get a better understanding of why that is the case. Some of that could be because of the fact that the pantry may not be in a place that's really accommodating where they live at. Some of that could be maybe their experience at their pantry itself, transportation issues, and so forth. And so those are some of the things that we want to learn more about in order to really improve the effectiveness of the program itself for the patients. Overall, the produce itself was very consistent, and clients were very excited about the product that they actually received at the pantry. One of the other things that we learned was that by the 3rd distribution, people were reporting that their food insecurity decreased, and that they were becoming more food secure by the 3rd time that they actually redeemed. Cost savings was a big thing for the produce as well. Many of our clients basically said that they were able to allocate the money that they were usually spending on groceries to support other things like rent and so forth. And so I would say most of our clients did say that this cost savings was a big benefit of participating in the program itself. Nutrition education was a big form of how we did this program. Everybody received nutrition booklets that was created by Barter Bites, and 2/3 of the respondents said that they utilized that information. The last thing I want to say was that the clinics also were very happy with the program. They didn't feel like it was a lot of work on their staff, and it was very easy to do the referrals and integrate it within their current processes. And so we got a lot of great feedback from the clinical partners. throughout every stage of this partnership. And so I believe my time is up. So this is my contact information, as well as Marcina Melendez, who is the program manager from MD Anderson Cancer Center, who did a lot of the program development with the clinics themselves. And so I'll be happy to answer questions during the panel as well. Thank you, guys.